suggest we will start. No doubt there will be some people entering a little bit later, but let's already start with the introduction. Welcome everybody to our monthly Science Meet Business meeting. Topic today is digital health. The city of Nijmegen some time ago has defined 2 economic clusters, health and high-tech, as important for Nijmegen region. And within the health cluster, we have 3 focal areas: drug discovery, healthy brain, and digital health. In September, we already talked about drug discovery. In December, we talked about healthy brain. And today, the topic around digital health is on the agenda. Predictions are that in 2040, 1 in 4 people will work in healthcare. And this, of course, is totally hypothetical, since it would be totally economically unsustainable to do it like that. But we have to think of other ways to make healthcare more efficient while remaining the quality. And digital health can be one of the building blocks to help keep our healthcare system financially sustainable, as well as of high quality. And by focusing on innovation in digital health, we want to position Nijmegen as an area where suppliers of future innovation can validate their solutions for the healthcare systems and therefore increase their markets. The program of today consists of 4 speakers. Tom van der Belt from Radboudumc University Medical Center, and he is the leader of the digital health focus area that we are talking about today. The next speaker will be Harry van Goor, professor at Radboudumc University Medical Center, who works with several companies on innovations in the R4Health program, and he will explain this program as well as how he cooperates with companies in making these innovations happen. And the last 2 speakers, Ivar Donker and Robert Muijsen, Ivar from Relitech and Robert from Arbol Healthcare, they will explain on their work in innovations, what kind of products they are making, as well as how they cooperate with Radboud University Medical Centers in projects. After the presentation, there is room to ask questions and some discussion. I would like everybody to mute their microphones during the presentations. There will be a bit of time after the presentation to ask questions. But I notice always that asking questions during presentations with these many people makes it too complicated. So please ask the questions after the presentations, and at the end of all the presentations, there is some room for discussions. Around 5 o'clock, the program ends, and after the program, there's still the possibility for online networking in some breakout rooms. I prefer to do networking in real time and have some bitterballs with it. But unfortunately, we're still confined to our homes, I'm afraid, at the moment. But it's still nice to meet other people. And the nice one about meeting digitally, networking digitally, is that it's totally random. So you don't know who you're going to talk to, which sometimes leads to interesting new connections. Some rules for the meeting: please keep your microphone closed, unless you want to ask a question, of course, after the presentation. It's nice for everybody to keep your video connection open so the presenters can see to whom they are presenting. It makes it a bit less lonely, so that's it's nice to keep those open. So this is for my introduction. I would like to ask Tom van der Belt to take the digital floor to explain about the focal area digital health.
Thank you, Martijn. Just a second. You see my presentation now?
Yes, we can see it.
Great. Well, thanks for having me. Just before the COVID-19 pandemic, we also had a Science Meets Business meeting about digital health, not knowing what would happen. And I think so many things changed during this year. When you talk about digitization and healthcare, that it's a great moment to discuss, to focus on this topic again, to discuss, opportunities and new, present some new examples. Martijn already mentioned the 2 clusters. So I will move to the next slide. I think digital health as one of the 5 focus areas is well chosen. Of course, even before COVID, healthcare was already under pressure, or at least facing challenges. And yeah, things got worse or more interesting. I can also say that with COVID-19. And yeah, digital health has the potential to improve healthcare and also welfare. So I think it's more relevant than ever. So let's move on. Digital health. I think I used this photo to explain digital health last year. Maybe this one would be better nowadays, but the point is that we communicate more with other people via our devices than we do in real life. And we see the same trend in healthcare. A little bit of history. Here on this timeline, you see all the great inventions, breakthroughs in science and healthcare. And in 2008, you see digitization. It might seem like the stranger in our midst, but I don't think it is, because it connects everything, all the technologies that have been invented before. So as a result, time and location are no longer a barrier. And a doctor, we will hear from a doctor today, he can do a surgery anytime on any location, and he can operate someone who's on the other side of the world. And that's all because of the digital technology and the opportunities we have nowadays. So I think digitization deserves a place on this timeline. And then we have COVID. And that one's interesting because it gave a boost to digitization. And according to a recent report from McKinsey, they said that on a worldwide perspective, because of COVID, digitization was accelerated up to 7 years. Of course, I have to, as a researcher, add that this is only about the world in total, so not about the Netherlands specifically. It's not about healthcare, but I think we can agree that in 1 year, we started doing things differently and faster than ever. If you look at education as well, we see the same. More specifically about our region, about Nijmegen or the larger Nijmegen area, we see a rapid uptake of video consultations. We see an increased use of apps. Healthcare professionals, researchers, but also patients and healthy people use them combined with wearable devices to monitor their well-being and their health or their disease. And in several places we see remote monitoring. And a last example is audio recordings. Because of COVID, we limit in healthcare institutions, we limit the number of people we want to see in a hospital. So as a patient, you are asked to come alone. And just imagine what that means for a person. If you talk about treatment options, it's often complex information. So it's very helpful if you have the tools to make an audio recording. And then when you come home, you can listen to it again, better understand what's being said, discuss your opportunities with your family and other relatives. So that's another example, and we see this happening everywhere. So not only in the Radboudumc, but everywhere else in our region. And we have an interesting region. Of course, the large healthcare sector. Martijn already mentioned that almost 1 in every 4 people works or has a job that's related to healthcare. We have a lot of human capital in different places. We have the digital health companies. And if you look at startups, almost 1 in every 4 is focused on health or healthcare. And our region is also known for participation. In the Radboudumc, we like to say patients as partners, and that also goes for other institutions. So altogether, I think it's a very interesting region because we are in such a small area. So if you look at our, let's say, ecosystem, I think you can call this our digital health ecosystem. We have everything needed to co-create, validate, and even to market digital health products. You can co-create anything with participation from inhabitants, patients, or other healthy people. You can validate products in the healthcare sector because we have such a large healthcare sector, or you can use real life data to validate your product. And we have the support to market your product. We have capital, we have other funding opportunities. So altogether, that makes us a very interesting region. Based on what I've learned over the past 2 years, we see 4, let's say, focus areas within digital health where we are active. That's first of all telehealth. That's the one that's very relevant now with COVID. We see a lot of self-monitoring and lifestyle. Then you're talking about wearables for healthy people, for patients, and even for healthcare professionals. We have VR and AR, for instance, for wellness and education. And I think we will learn more about that today. And at last, but not least, we have early detection. And there you're talking about artificial intelligence, for instance, to improve health outcomes based on images, or based on real life data. You can maybe early detect clinical deterioration or recovery. Well, some examples. This is Farmy. Farmy is a digital assistant and works for the Maartens Clinic. And I think it's a woman. So she works there, and she will definitely not replace the pharmacist anytime soon, but she can help pharmacists and other people who are working at the pharmacy with repetitive tasks like informing people about medication, how it should be used, etc. And what's interesting here is that it combines, it has a visual component and an audio component, and that might even improve the uptake of information. Well, then we jump to AI. Just some examples. It's not a complete list, but ScreenPoint Medical, they use AI to screen mammographies. Arna Health, AR and AI for real-time data and real-time protocols to support doctors when they're busy focusing on the patient. DeepD for AI eye screening. I think you also know Tira Lab with Tirona for image analysis. And of course, Nijmegen, as the only city or region in the Netherlands, has 3 ICAI labs focused on health. And ICAI stands for Innovation Center for Artificial Intelligence. And I think we can be proud of that, because there's other ICAIs, but not about health care. Last example, the CWZ Thuis app for people who are recovering from COVID. There's many other examples of apps, but I think this one is very relevant now because it's a simple app. It has been validated. People can use it. Almost anyone can use it. They don't have to come to the clinic because they can self-measure, for instance, their blood pressure and share it with their healthcare providers. And yeah, so many opportunities with apps combined with wearable devices. So altogether, I think, yeah, I already mentioned it, but we have all the partners in our region on a very small area to develop digital health solutions in co-creation. We can validate them with real life data and we can market them. So why don't we fantasize about a digital health hub? If we become one, we could even further optimize healthcare and welfare and strengthening the economic power of our region. And I would like to conclude with two examples. First, from the perspective of a businessman or a businesswoman, that's what they told me, at least. If you have your product, you want to validate it in the healthcare sector. So you need access, and you need, you need the opportunity to use health data, just to do a proper validation. That's one. And from the perspective of a doctor or a nurse, you want to know where you can find the business partners to develop your product, or you have an idea and you want to find the right partners to work on it, because you have to do it together. I think a digital health hub might support them there. So I'm looking forward to your ideas and needs. If you're interested, let me know in a breakout session, or otherwise contact me. I look forward to the other presentations, and thanks for your time.
Thank you, Tom. We have time for one question. Maybe, is there somebody that at this moment wants to ask a question? I myself have one. If you look at all the things we can do, what would be the most relevant new activity that we could take to strengthen the digital health in Nijmegen?
Yeah, I think there's many things we can do, but I think we should help businesses by better explaining what our needs are. And for instance, we could start challenges and try to tease companies to develop a product that meets their needs. So I think that's step one. We know what healthcare needs. We know we have so many doctors and nurses with great ideas. We have so many companies with interesting products, but we just have to better connect them. That would be my answer.
Make it more demand driven there.
Yeah.
Okay. Thank you. Then I suggest we go over to Harry van Goor, who can explain from his view as a doctor in Radboud University Medical Center what these kind of projects can mean. Harry?
Yes, thank you, Martijn, and it's a great privilege to speak to you all about our program on personalized healing environment. Let me see if I can see a little bit of you. Yes, because then it's not in the way of my slides. This program is, I'm telling you a little bit about the progress and results we made in this program that's now underway for about 2 years. And we give this subtitle to the program, Together We Make Healing Sensible Again. And this relates to the 5 or maybe the 6 senses we have. And we are actually in this program going back to ourselves and to our brains and what's going on in our brains regarding a couple of relevant topics in healing. This started this program with an encounter between healthcare designers and surgeons, and we learned that we have our initiatives and activities on the same topics. The designers, healthcare designers, try to improve or to reduce stress, reduce pain, improve sleep, and improve mobility by designing their environment. And we, from our perspective, know that stress, pain, immobility, and disorders, sleep disorders, are denominators of a bad healing and of a bad recovery and bad outcome. But in contrast to what a traditional healing environment means, and this means bringing, let's say, example, nature into the hospital, or bringing playing with light and more light in the hospital, we thought that this is not applicable to every patient, because there are individual needs. There are from an individual, there are different needs during the stay in the hospital. So we thought this is not the answer the authentic idea about healing environment is not the answer to our personalized healing environment. And therefore, we hypothesize and postulate that we need integrated digital technology to personalize this healing. And there we joined together a couple of years ago with One Knowledge Institute, which is the Radboudumc, with 5 private partners, which are depicted here. And these are all partners that are very complementary to each other. And 2 of these partners will have a talk after my talk about the collaboration. And we were funded by the European Fund for Regional Development with a generous grant, and that brought us on our route about 2 years ago. So what was the idea of our program? And basically, when you look at the left side, we want to profile our patients regarding stress, pain, mobility, and sleep. And with this profile, we like to predict what type of healing tools we have to provide to this patient in a patient room. And then we censor the outcomes of using these tools, and we use these outcomes again to more perfect, more optimize this prediction. And this brought us to the concept of a sense, analyze, diagnose, and response concept, which you can apply to a lot of things in healthcare. And then after your response, you can you can sense what your response is. And then again, this is an iterative process. At the right, obviously, with this program, we want to make impact in terms of reduction of hospital stay and reduction in hospital readmissions. But these are typically the hard impact, but also the soft impact, meaning the patient, improving the patient empowerment, the patient self-management, but also patient satisfaction, well-being, and functioning and quality of life for years and years after being discharged from the hospital. We started 2 years ago with 2 mock-up rooms, and you could see this as a type of living labs. And these mock-up rooms were reflect the single bedrooms we will have in the new building in the Radboudumc. And one of the mock-up rooms is we do validation tests of technology with volunteers. And we pick these volunteers typically as a population that reflects the hospital population. So in contrast to other parties who are in this business, we collaborate with patient groups that have an age above, let's say 55, because these are the population that generally are for more than 1 day in the hospital for treatment and other things and interventions. One of the mock-up rooms is at the neurology ward, which means this is an authentic situation. And we specifically thought that we have to do this in an authentic situation, because then the complex situation of healthcare, we include that in our design and validation processes. So here on this slide, you will see basically the toolkit we have with our digital technology. And as you can see my pointer, I guess, and then you see that we see an audio-visual wall, which is one of the tools. You see VR glasses, which is one of the immersive tools for the healing environment. Then a body-worn wearable, but this is we also using other sensors that are, let's say, health patches or similar things. And then you see in this on the ceilings, you see other sensors and cameras. And this basically is, with the interface in the hand of the patient, is basically the toolkit we use in our personalized healing program. The first thing is, and that's done by a Center for Moods, which is the audiovisual wall. And we use this as a relaxing environment. you can see this as a sort of a positively affecting the arousal that's going on in the patient room. And with this relaxing environment, there's a choice menu for patients to choose their favorite environment. And this is what we know, what the patient knows based on their profiling. And as you can see here, that we use in this case on the right side a patient that has a favor of beaches, and most of them tropical beaches. What we also do with this audiovisual wall is that we try to improve the circadian rhythm. We know from patients in the hospital, particularly those that had surgery or were on the ICU, that they have a disturbed circadian rhythm, which means that they sleep during the day and they are disturbed and they can't sleep during the night. And what we do with this audiovisual is also to make a circadian rhythm in these visuals, and that means that we play with the light and the amount of light during the day, and automatically this is going from a very, let's say, white light to a more yellow orange light to improve the sleep. And then, as you can see here, the choice menu, and I show this video also not because only the audiovisual wall and the menu, but when you look at the carrier of the tablet, there's also some spin-off in other, let's say, hardware that we might use in the room. So this is a tablet holder that might be very easy when a patient is lying in bed. So we are at the level that patients are confronted with this audiovisual wall. They are choosing what they like. We sense what is helpful, and this is one of the quotes the patient has, and she says that it surely distracts from this spouse who visited that day. They almost celebrate a holiday at the place where they always like to be. Then another feature of this audiovisual wall is playing games on this audiovisual wall, and this is more to in a process of healing, recovering, and distracts himself by doing memory games, cognitive games, but also games for exercises with the upper extremity. And what we found out is that for this patient population, it's not these games which you would expect like the youngest are, but these are typically, let's say, old-fashioned games, puzzles, quizzes, etc., that this patient group likes. And then we can also build in these games the feedback the patient has on how it works on their pain and their stress level, etc. So there's also a feedback mechanism in it. Obviously now a quality to the pain, but in the future this will be automatically sensed by a stress or pain sensor. So this is at the status of volunteer validation, and we are almost finished, and we want to enter now with this part of the program into the clinic. And again, it certainly kills time, because we discovered that a lot of patients think it's very boring in a hospital, particularly when they recover a little bit, and that it can help you with the pain relief by change of focus. Then another part of the toolkit is virtual reality classes. And with the virtual reality class, we typically can immerse patients. We can bring them in another environment. And because with the glasses, a patient is disconnected from the environment, this is typically meant for patients with acute stress, acute anxiety, with severe pain. There we already passed a lot of tests with volunteers, and so far we did 3 validation studies to actually find out which patient at what time benefits from which VR content. So it's like a pharmacy, a VR pharmacy, in comparison with a pill, which medication is good for which patient, in which condition, and in what doses. And to give you an example, we profit from the COVID period, so to speak, that we validated movement games, so exercises in VR for patients who had post-COVID complaints. And we learned from that these patients like to move at home, but on the chair sitting, because they were too exhausted to do these exercises when staying around, and they had a problem with their balance. So it means that this information, this validation information, we now bring it back to the clinic, and this will bring into virtual reality so that patients can also exercise when they are in bed or sit in a chair. So this is an example how we do our validation. We dare to go outside of the hospital and to bring in information and validation information into the personalized healing environment in the hospital. So last year with the coronavirus crisis, we learned, like Tom also said, we learned actually a lot, and it accelerates some of our in some parts it accelerated the program, but in other parts it did not accelerate our program, it slowed down our program. But what we learned is that safety and feelings of safety and feelings of well-being and
I think Harry has been disconnected. That's one of the challenges that we don't have in physical life. Let's wait a few seconds if he comes back on again. No, I'm afraid he... let's see if we can then revisit it if he does come back back online. But my suggestion is then that we move on to the next speaker for this moment. Ivar, can you start your presentation?
I can. So, thank you, Harry, for the introduction earlier. Harry, let me introduce myself first, but not before thanking you for being here or being there. So my name is Ivar Donker. I'm the co-owner of Relitech, and Relitech is a contract developer of basically medical products or medical assemblies, and we are a partner in amongst others the project that Harry just described. So it's called R4Heal. And what I will do, I will tell you a bit of our role in it and what we do and how it is to cooperate with people from completely other disciplines, and in the end to try to make a nice product. So let me see. So our company is 25 people. Most of them have a university degree and work in the field of mechanics, electronics, software, and building algorithms. For us, it's always a matter that we either do a part of a device or the whole integrated device. And we have quite a wide scope of the activities that we do. So sometimes it's just a simple mechanical device that we have to create for our clients. And the other time it's more complicated product where we work with several integrated partners. Our company is certified, which is very important in the development of medical products. So we're ISO certified. And we are also FDA registered, because the products that we make for our clients, they are also being sold to the United States, and they require very often an FDA certification on the product. So the scope is in this sheet. It all comes together where there is, of course, mechanic part, software or embedded software that needs to be developed, or user interface software. There's electronics involved, electronic tests that need to be done. And then, of course, the more fundamentals like the risk analysis, which are very important for your risk files for the certification, the norms and the regulations, and of course, besides that, the more soft skills such as the analytical skills, the skills of creating together, of working together with the other partners in the project. Normally, the approach is one where we have a look at a concept, if there is a concept available, or sometimes it's from concept we work to development, from development we start to engineer, to produce, and to maintain the goods. So in a lot of cases it doesn't matter where we are, that we either there is a prototype or we have to do some engineering, some design for manufacturing. And what we often do then is that we have a look once we start with a concept, and to have a look at what is already available in a market, and with what kind of sensors you can work instead of inventing a new one. We do a risk analysis up front, so you take out the risks in a development and do a feasibility there. And so that you can work with milestones, and also that you got the showstoppers quite early in a process. We work very strong together with our clients, which in this case is the Radboud University with this project. And of course we also work with other SMEs, sometimes also multinationals, which is a bit strange for a small company in the middle of Holland, but that's then very often due to the specific skills or the specialisms that we have. In this case, the R4HEAL project already had a history, and I knew Professor van Goor from earlier products. And at the first time, I still remember that when he told me what he was about to, that I was a bit astonished, because it was not the development of a device, it was a complete concept. And more important, also there were soft parts in the concept, like the well-being and the well-feeling, or creating a good atmosphere for the people, which doesn't sound always too logical. And besides that, there were also some challenges, and one of them Professor van Goor told earlier about the profiles that needed to be made, like how stressfully is a person. I will get back to that later. So what we do normally from as a strategy, we have a look at our partners and what skills they have, and what needs to be done to make a complete product development. Like I said, it's always important to have a very diverse team. Also important to get the good feedback of users of products, get the right knowledge in, and of course we have in our business quite a bit of knowledge with everything that we developed in the past 20 years. So especially
2 minutes, because otherwise we will run out of time.
Yeah. Okay. So what we did with this project, we had a specific task package or working packages of sensor selection, of development of wearable measurement devices, and we also had to calibrate the data and get it into to measurement data and develop a user interface later on for the patients and also for the caretaker. So what we developed, we first of all we had to develop a patch due to some requirements that were made earlier. So what we did is we had a look at what do we have to make, and we started creating our own healthy patch by designing a PCB with available key components so that you get a relatively cheap patch. We designed it, like I said, with using the off-the-shelf articles, which ended up in a sensor with the Bluetooth mode, integrated features in it, like an accelerometer, so you can see whether a patient is lying or standing. You could put all other kinds of things to it, like where the patient is exactly, if it would be in another location, that you can see him move. And most important is also getting a lot of data in it and having a large battery life. And we combined it then with patches that are disposable and very cheap. So the sensor is reusable and the patch is very cheap. One of the biggest features on the patch is that there is a heart rate variability measurement in it, and the data that we get from the heart rate variability is being processed, and where we made together with a other project partner in it, where we developed an algorithm just to see whether somebody, in what kind of state somebody is, whether he's in a stress state or not. And one of the most important parts there is also that you can measure continuously. So when it comes to the patch, then the patch is created, but then of course you only have data. So we had to look at the heart rate variability in order to get to create an algorithm that constantly can measure the stress. We did that with an elevator test. How it works is you get a VR glasses on, and you virtually step into an elevator. You go to a high floor and the door opens, and out of nothing you only see a plank standing, and you're supposed to walk on the plank and have a look. Which leads to a lot of stress. That is what you see over here. So we measured it you measure in 3 points before you start to walk on. You step on the plank. Once the door opens, and here after you've walked on the plank. And with these data that was created, you get the biggest indicators of stress from on a scale from 0 to 100. And then of course you start working on making the algorithm and trying to make it very the bandwidth very narrow and very close. So that is something that is under construction right now, or where we are working with. And well, so that is one part, that is one profile, the stress, and how to measure stress and how to make an algorithm out of it, which was in this, which was with a challenge in this project, and still is. On the other hand, you can measure all kinds of other things. What we do, for example, we also measure for people their breath and their rhythm, so that you can also predict for COPD patients, for example, when they get an exacerbation, and so you can send them a push message that they have to take their medicine. That is one of the other examples when it comes to digital health. And of course, there is lots of other needs and ideas, and well, maybe we can talk about that later, but
very good.
That's it for now.
Thank you, Ivar. We are running a bit out of time, but I see that Harry is again with us. It's not something that happens in real life, that the presenter suddenly disappears, but Harry, do you want to take take the rest of the presentation now? Your microphone is still off. Your microphone is still off. It's yes. Now
maybe do Robert first, and
okay.
Okay, and maybe I'll with the questions I can illustrate something. Okay.
Perfect. Okay, Robert, can you take the floor?
Yes. Diana, is my presentation visible?
Yes, we can see it.
Okay. Well, thank you. Good afternoon, everybody. My name is Robert Muizers, owner of the Arbel Group, with my companies Arbel AI or Arbel Healthcare Real Estate. And you for sure questioning what is a healthcare real estate doing in this conference, but I hope to explain this in a couple of minutes. Short introduction, personal, living in Brabant, local in Housden, with a technical and business administration background. With my company's Arbel, in general, we develop real estate, especially in the healthcare section. I will explain it a little bit later. And besides that, in my opinion, every entrepreneur also has a social contribution to do. So, for example, I'm a member of the supervisory board of Amsterdam in Amsterdam, one of the biggest elderly care organizations in the Netherlands. And I think especially for an entrepreneur to sit aside on the table like that, it's inspiring and also very learnful. To give you some business references, what we do is develop real estate, especially in healthcare. For example, a hospital in the north or in the south of the Netherlands, Vickery Medical Center, or primary care organizations in Eindhoven, to the elderly care organizations. Why I do present this? Because here in the Netherlands, what we see is a mix and an influence of an intense of cooperations between this kind of healthcare organizations. And especially the labor force market is very demanding at this moment, and the budgets are under stress. And to do this, one of the most easy parts is to make a mix of your real estate and use the same budget for different goals. And in general, this is one of the business purposes and what we do at this moment. And that means also that we do have to understand what every healthcare organization drives for his market, and what this means in organizational terms and in financial terms to do what they do. But 10 years ago, I think I discovered that my business was changing, and rapidly, in my opinion. And because we saw that, especially in the Netherlands, we built less hospitals, smaller hospitals, and the main question is what this physical environment means that influence, for example, the stress factors of patients, of your organizational culture. So I changed my business and focused on what physical environments and dynamic forces will influence the organizational culture. And to that introduction 8 years ago, we stepped also in the technical developments to make a combination of this. So today, hospitals or elderly care organizations, they ask us to help them to make a mix of technology and healthcare real estate. And at that point, I met a guy, Professor van Goor, 6-7 years ago, and we shared the same goal, how to make a combination of this, and also to make the benefits, including the financial budget, to the technical challenges that lay ahead, especially for the patients, for example, to reduce the stress, because physical environments can influence that. So why did I participate in R4U? It is a challenge for my business. It answers the questions I have and I have to explain to my clients. And we can provide existing products with new products to the same clients and budgets. And of course, a good team, what was introduced here, is always, well, a challenge to hop in. And to be honest, a subsidized project like EFRO here is new for me. And as an entrepreneur, in general, I'm a little bit reluctant to step in subsidized projects because, of course, everybody is looking and you want to go straight forward, especially the combination with scientists is well, reducing the speed, but that's good in my opinion. So what is my role in R4U? My responsibility is to generate business for R4U as a whole, but especially also for the individual parts with the knowledge of the healthcare sector and all client contacts that we have. So we do the market explorations, the eyes and ears, especially for CSER, for example, the Cinematic Clinic, who are, well, supportive partners in this project, and to develop the business that what we foresee ahead of us. And of course, working together in a consortium with people. 2 years ago, I think in general, we didn't know each other, and we're making very good steps to glue it together as a potential new company with this new product, as a whole or in parts. And what is my experience when I compare business versus science? Because in general, and of course, we worked together in the past with, for example, the Technical University in Eindhoven, or Enschede, or the Business University in Amsterdam. As an entrepreneur, you want to go ahead, maybe even too fast, and scientists, they say, wait a minute, I have 10 more questions before you step ahead. But my construction business is very, very traditional. In general, my opinion, healthcare people, they think their business is traditional. Well, I think the construction business is even more than that. And we, as a construction business, especially in development, can learn a lot from them. And our first steps are evidence-based design. So the designing companies, they're really speeding up at this moment, but the construction business is well, I think you have a couple of years to go. It at odds with the technology developments and the clinical medical developments. They're way ahead in innovative processes and how to implement new products. And of course, in healthcare sector, they think from themselves, well, we have to speed up. Well, if you compare it with other sectors, I think you, in general, do a very good job. And what Harry, Professor van Goor, and also Ivar explained, our physical environment and all sensors, they challenge us, how we behave, how we react in our own condition, in our physical environment. And this is what we try to answer with R4U and make a healing system for our patients so that they can heal faster and go home much more sooner than even maybe expected. And that together is for me a very important answer, because if that's the truth, all developments in hospitals, well, including nursing homes, etc., will change. well, our cooperation with Radboud, I learned a lot, and I hope they will did learn some from me. But it's a challenging task for the entrepreneurs to the what ifs, as I explained them, versus the how to. The entrepreneurs, they ask questions, it's okay, how to, and they're thinking solutions, and they want to go to the market as soon as possible also to sell their products. But if we do not cooperate with the Radboud and have the clinical trials, etc., for our project, yes, maybe we go very fast to the market, but to total different market than we started with. And it's the difference, in my opinion, it's a little bit black-white comparison, that we are making gadgets instead of clinical validated products. And that is, I think, the difference what we do with R4U as a team, and especially the continuously discussions, questions, absolutely in a positive way. The what ifs, they still ask questions, but you as an entrepreneur, why do you do this? Why do you go too fast? That's for me the most learning part in this case. So till now, I'm very glad to join with Radboud, and of course also the other R4U partners.
Thank you, Robert.
Thanks.
I'm looking at Harry at the moment. You can't see that, of course, but do you want to still show some of your sheets, or shall we just have some discussion at the end?
Yeah, maybe I can, if it works, I can.
We had a discussion before the session whether Harry should be first or last, but now you arranged it that he is first and last.
Yeah. Maybe I'll. Can you see my screen?
Yeah, it's best to put it full screen.
Yeah, I know. So I skip a little bit and show you one which we started with this UvA company, and this was in last year with the Corona crisis. And you can see here that while tracking not only persons but also instruments and masks and protection clothes in the room, you can have a completely different use cases regarding workflow, what's going out around in the room. And this is also regarding safety. When you look at hygiene and infection prevention, this is a test we did, and this is almost complete. We built an algorithm together with UvA where we can map where you touch the so-called high touch surfaces in a room. And what you can see here is the bed railing. And this means that you can much more target your cleaning in between the normal cleanings to get rid of your contaminated areas and to do have some major progress in your infection prevention. And then the other thing, it looks like in your dashboard, it looks like that you have complete workflow, what's going around in the workflow, what patients are doing, not in terms of vital signs, but more in terms of are they in bed, are they going around, are they out of bed, around in progress, and then you get a signal that in one room there's a high contamination just now, which means that there has to be a schedule for the cleaning. And that means that there goes a signal to the cleaning service, and then the room is cleaned in between. So I'll end with this slide, and this is like, do you remember these times slides, where this was the kickoff with the whole team, and there we see this our actor. Actually, he's the director of Big4Data, and he acted in all the photographs we showed you in the room. So thank you very much, and thank you also to the European Fund and the province and OostNL.
Thank you, Harry. Yeah, we come to the end of the program. We're running a little bit late. There's room for some questions. Is there anybody that would like Jos Knapen? Can you unmute?
Yeah, I've got. My name is Jos Knapen. I'm from I'm innovation manager at the Isla Hospital, somewhere up north.
Yeah.
I'm working on a serious game about tempting people to start moving in their, or to tempt them to get out of the bed. And when you look at R4Heal, it looks really comfy to stay in bed because everything is focused from the bed. Do you take things like movement and tempting to people to get out of bed also in consideration in R4Heal?
I guess it's an answer for me, and the answer is yes.
Yep.
Actually, we know from a lot of studies that although you have a lot of activities to get patients out of bed, sometimes patients are too sick to get out of bed. And I also have this example that if you have a 40 degrees fever and you, let's say, has COVID at home, the only thing you want to go to do is to lie in bed in a fetus situation, and you don't want to be disturbed at all. So so we started with our program movement in bed and in the chair, because we know that we lose a lot of time when you only focus on movement out of bed, and then you try to get people out of bed, but then probably they're out of bed after 2 or 3 days, and then you lose this momentum for the first 2 days where you can move in bed and move on the chair. And this is all based on studies we did, clinical studies we did, and are published. Nick Koenders has published that in a recent publish. That's a physiotherapist.
Okay.
But actually, the answer is we do a lot to let them move in bed from the beginning, also in bed, and and when they can walk, I say when they can walk, they can go home. You know what I mean? So to speak, it's like another concept.
Thank you.
Here. Anyone else for questions? I can't see everybody, I think, but at this moment I don't see. I have one question for both of the companies, maybe. If you look at that, so you're doing this project together with Radboudumc, if you look at the biggest strengths of the Nijmegen ecosystems around health, what would you say is a big strength, and what would your advice be that could be better? Ivar, you maybe yes first.
Yeah, I think I see the big strength that there is. The cohesion is big in the area, and I can say that because I used to be one of the earliest tenants in at the Noviotech campus, and that's where you meet people, and well, everything comes together there. So people from the university, the business life, etc. So there, I think that is very important and very good. That's it. That it's available, including, of course, Oost NL and what they can do with you, how they can accelerate your business. And what is a good advice? Ooh. That says enough, because I think it is working already very good. So, and at this moment I'm thinking again to come back to the Noviotech campus and install myself again over there in a nice office, and yeah,
we'd love to welcome you.
Yeah,
Robert.
Well, I agree completely with Ivar, and well. If I take the deep dive to the critical part, I think, well, in general, I think we have to stay critical, and also to each other, to focus on the job. Developments are going really, really fast, and well, a lot of countries they accelerate at this part, at this moment, in a speed you cannot not even imagine, in my opinion. So we have to be critical to each other in a positive way to generate businesses, including, of course, with the science part.
Yeah.
But that's well, in general, Martijn, just human behavior.
Yeah, no, but that's important. I think the critical part to get get more out of it is always important.
Yeah.
You learn more from critical things than from only the positive things. So that's definitely important.
Yep.
Okay, yeah, we are running out of time. So unless there is somebody that really wants to ask questions, I don't see at this moment. As Tom already explains, we are working on to create a platform at a digital health hub where payers, providers, patients, and producers companies can work together to bring innovation to the market. And anyone interested in more cooperation on this can, of course, contact us, and we'll see where we can cooperate to make digital health in Nijmegen bigger. With that, I would like to thank you all for your attention and the interactions. We do hope you have enjoyed the program. Next SMB meeting will be on the 4th of March, and the topic will be One Planet. Probably many of you will know One Planet is a new initiative in the region where the province puts a lot of money in. It's a combination of Radboudumc, Radboud University, Wageningen University, and IMEC, the big high-tech organization. Around it, I think there's lots of potential for working together on innovation with this ecosystem. And we'll discuss that on the 4th of March. For those sticking around for networking, Marion will